The Cuyahoga Human Resources Appointments and Equity Committee has been called to order. Madam Clerk, would you please call the roll?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Turner. Mr. Gallagher.
Here.
Mr. Miller.
Here.
Ms. Conwell.
Present.
Mr. Sweeney. Mr. Sweeney is absent at the moment. You have a quorum.
Okay, thank you. Do you have any public comment?
No, Madam Chair, no one has signed in.
Okay, can I have a motion to approve the minutes from the October 3rd meeting?
I so move.
Been moved and seconded. All in favor?
Aye.
Madam Clerk?
Resolution 2023-0267, confirming the county executive's appointment of Kim Shelnick to serve on the City of Cleveland, Cuyahoga County Workforce Development Board for an unexpired term ending July 31st, 2026.
Madam Chair, we have a proposed substitute. The proposed substitute changes the appointment of Kim Shelnick to a reappointment and changes the term to state July 1st, 2023 through June 30th, 2026.
I move acceptance of the substitute as the version before the committee.
Second.
Been moved and seconded. All in favor?
Aye.
Aye.
Thank you. On behalf of the county executive and pursuant to Chapter 6301 of the Ohio Revised Code, I'm here to recommend the reappointment of Kim Shelnick to the Cleveland Cuyahoga County Workforce Development Board for the term July 1st, 2023 to June 30th, 2026. And Kim Shelnick is here for her presentation.
And Zoe, if you could just state your name for the record, please.
Zoe Toscas.
Thank you.
Good morning. Please come forward. State your name for the record.
Good morning, Kim Shelnick. Hi, everyone. I'm Kim Shelnick, and I'm the Vice President of Talent Acquisition and Workforce Development Planning for University Hospitals. I've been in my current role at University Hospitals for 17 years, and I oversee all recruitment strategies, pipeline building strategies in the community, along with a focused attention on hiring directly from our under-resourced neighborhoods in Cleveland. For example, UH fills over 9,000 jobs annually that are external, and we are part of the Healthcare Anchor Network to really focus on that community workforce development. And so right now, UH is filling close to 30% of our positions in Cuyahoga County directly from those particular zip codes in Cleveland. And we do that through multiple different workforce development programs, from many apprenticeships and earn-to-learn initiatives. And I've already been on the workforce board for over 10 years and very involved. I'm on the Strategic Functions Committee along with the Executive Committee. And being one of the largest employers in Northeast Ohio, I provide a lot of advice on what's happening in healthcare, specifically the significant shortages that we're dealing with. I think all of you know that, for nurses, allied health professions, there just isn't enough supply. So I work with the board to really look at how do we get into the high schools, focusing on youth initiatives to get individuals interested in healthcare so that we have a future of moving talent into those positions. And that's why I also spend a lot of time focusing on those workforce development programs to move youth and others into healthcare opportunities. So I do believe that, having strong employer representation on the board is extremely important. So I sincerely appreciate your consideration to be reappointed to the Cuyahoga County Workforce Board.
And thank you for continuing to dig deep and, find more.
Thank you.
You're already doing so much. Can you tell us a little bit about how COVID has impacted workforce?
Yeah, it significantly impacted, especially in healthcare. So it was very difficult for our healthcare providers to take care of the patients during COVID. So it's been a long path over the last several years to really get that reengagement and interest to go back into healthcare. We saw so many healthcare providers, leave the profession and retire. And so it's really been a battle to really show the importance of being a healthcare provider and the difference you can make and how you really can move up within the organization within Pathways. So we're starting to see, positive movement, but there's just so much work to be done. And that's what I love about being part of the board, is that we can come together as a workforce ecosystem to work through those challenges.
Okay. And you mentioned youth initiatives and youth programming and providing opportunities to introduce the next generation into healthcare opportunities. I remember when I was a young lady going to the School of Science, there was health careers. Is health careers still around?
They are. So there's a lot of structured initiatives where we're really trying to focus on how we engage the youth. So at UH, we have multiple different programs, and one of them is the UH Nursing Academy. So we reach out to youth to get an interest in nursing during the summer months. Same thing with a program that's called UH Scholars that is really focused on future doctors. Along with the work on the board, there's a lot of youth outreach along with the healthcare sector partnership in collaboration with the funders group. There's many youth programs that, we're focusing on through coaching, all the way from 6th grade all the way up to 12th grade. And there's some schools that even have programs that prepare them. And we work with Newbridge, for example, to do that.
Okay. Put up for my colleagues. Councilman Miller.
Good morning, Madam Chair to Ms. Shelnick. Thank you very much for continuing to serve and for your hard work and dedication. And we've had a tight labor market across the board for a few years now. And my question is whether you think those conditions are likely to continue, or do you see some evidence of the labor market starting to soften as the interest rates have been raised and some pressures being put on the economic system?
It's a great question, and we talk about this consistently, that it is starting to soften as it relates to the short-term certificate programs and our entry-level opportunities. Where we're starting to see more of a candidate flow and interest going into those positions, especially since we're offering more of those earn and learn programs to go into maybe a phlebotomist, a pharmacy tech, which is a certificate. Where we continue to see significant challenges where it is not getting better is in the areas of the associate and beyond. So it is focused on a supply and demand gap where we're not seeing enough graduates coming out of the schools to go into those programs. So the work is important that we're doing, for example, with the healthcare sector partnership, where we just received a DOL grant to really focus on working with the community colleges to help with the enrollment and also with the graduation rates and passing the NCLEX, which is the license certificate to become a nurse. So that's the type of work that we're doing too, to be able to focus on that supply and demand gap in those critical areas.
Madam Chair to Ms. Shelnick, does the tight labor market make it easier to help the reentry population and others who might have barriers to employment that might keep them out in a more competitive market to help them to find employment?
What's tough in healthcare for reentry is that, we have those Senate bills within Ohio that are pretty rigid on who we can hire, but we are very thoughtful in adjudicating every situation. But as it relates to what I said earlier, you're seeing a lot of that talent go into more of those entry-level or even certificate programs. So it really isn't still solving the problem of where the shortage is the associate and above, unless we really continue to focus on how we move all into those degreed programs.
Thank you.
You're welcome.
Cromwell?
Thank you, Madam Chair. To Ms. Shelnick, I don't really have a question, but I've also tried to work on, labor force connecting with the youth before COVID. So if you would leave the clerk your card, maybe we can talk about some of the initiatives I tried to work with Metro on.
Oh, great. Thank you.
Thank you.
You're welcome.
Is there anybody else here with you this morning okay. Well, I think if there are no more questions for you. Again, I want to thank you for your desire to continue this service. You know what, I did have a question. I was curious. You mentioned that you were on where did it go? The Strategic Functions Subcommittee. Can you tell us a little bit about your work there?
Yes, absolutely. So on the Strategic Functions Committee, our main agenda over the last couple of years was to move the board, I think you're aware of this, to a nonprofit. So a lot of attention has been on that particular subject, along with really looking at our key deliverables within the board and our main objectives and strategic plan.
Well, seeing that we have no further questions for you, thank you so much for your time. May I have a motion to,
Madam Chair, do we need suspension on this, given that the term has expired?
We did not ask for it, no.
No, okay. I'll move that we favorably recommend the reappointment of Kim Shelnick in Resolution 2023-0267 to the full council for second reading.
second?
Oh, second.
Moved and seconded, all in favor?
Aye.
Aye.
Thank you.
Thank you.
Thank you, Kim. Madam Clerk?
Resolution 2023-0283, adopting various changes to the Cuyahoga County non-bargaining classification plan.
Good morning, Madam Chair, members of the committee. I'm Albert Bushaheen with the PRC, manager of the classification and compensation team. One of the items for your consideration this morning is a result of one of the DEI initiatives the PRC is undertaking to support the county's efforts to become an employer of choice through our work with systems involved in employment for non-bargaining personnel. One of our goals in 2023 is to address potential barriers to employment in the county's non-bargaining classified jobs in an effort to increase accessibility to these jobs. Over 30% of the county's classifications currently require a driver's license. To prevent any socioeconomic impact on our applicant pools, we wanted to ensure that the license requirement is truly a legitimate requirement for each of these classifications. The Class and Comp team reviewed these classifications and worked with the department management teams to ensure that this requirement is a valid one. The results of this work brings us to the request before you that the driver's license requirement be removed from 30 or 25% of the 119 classifications that currently require driver's licenses. In addition to the driver's license project, we've commenced a review of 94 classifications in the class plan that require either a pre or post-hire certification to qualify for employment. We hope to bring you those findings in early 2024. Another initiative underway is the addition of equivalencies to all non-bargaining classifications. Most classifications' minimum requirements end with the language of and/or equivalent combination of training and experience. We believe that many applicants that may not have the required post-secondary degree may self-select out of applying. Therefore, we've defined what those equivalencies are, but of course, that alone won't increase the number of applicants, as potential applicants only see postings, not class specs. Therefore, we've partnered with the Department of Human Resources, which will include all these equivalencies in their future postings. Lastly, the county creates and utilizes a number of job documents in its employment processes. Applicants view a job posting for a vacancy online for classified position. This document is usually generated from the information in the classification specification and maintained by the Personnel Review Commission. The PRC also writes job descriptions for specific positions included in each classification for test development purposes. The Human Resources Department writes job descriptions for unclassified jobs and positions covered by the collective bargaining agreements. These documents viewed by applicants or employees at some point in their employment life cycle with the county. With this, we're committed to ensuring that these documents are free of bias and reflect the county's commitment to diversity, equity, and inclusion. Some words play to male and female stereotypes. Male-coded words such as driven, decisive, or analytical can discourage women from applying for jobs. Conversely, female-coded words or phrases such as support, collaboration, or interpersonal may discourage men from applying. Certain words may discourage members of certain racial, cultural, ethnic, or age groups from applying to county jobs. The PRC identified text analyzer software that can help identify potential biased language in job documents and recommend neutral solutions to minimize the potential impact on the biased language in these job documents. We again have partnered with the Department of Human Resources to secure funding for 2024 so we can put out an RFP to secure text analyzer software. In addition to job documents, the software can be utilized to address potential bias in other documents, such as employee communications, personnel policies, and handbooks. This is a product that both Human Resources and the PRC would use to increase and have a more diverse applicant pool, which would eventually translate to a more diverse employee population. This is a collaborative initiative between the PRC, Human Resources, and the Department of Diversity, Equity, and Inclusion. Lastly, Madam Chair, members of the committee, before you for your consideration are modifications to the county's non-bargaining classification plan. We are proposing the revision of 12 classifications and the deletion of 2 classifications as part of the PRC's routine maintenance process. 2 of the revised classifications, Supervisor of Nursing and Senior Supervisor of Nursing, have increased in pay grade. The incumbents' salaries all fall within the proposed pay grade, so there should not be any fiscal impact unless Human Resources increases their rates of pay. The classifications proposed for deletion do not have any incumbents in them, and the departments have no plans to utilize them in the future. All the modifications were prepared by the PRC's Class and Comp team, who's worked with the Department of Human Resources and department management teams to ensure they're fully aware of the proposed changes before you. In accordance with the PRC rules, the proposed changes were posted on the PRC's website prior to your consideration today. The PRC considered and approved recommending these changes at their September 13th meeting. I thank you for your consideration, and I'll be happy to answer any questions you have.
Okay, thank you so much. As it relates to the pay grade increases, how many employees are impacted? How many employees are impacted, and if any, what is the budgetary impact?
There is no budgetary impact. The current salaries fall within the current pay grade. Now, Human Resources, at their discretion, can recommend rate changes. If they decide to do that, that's something that they would have to justify somehow. But from this change alone, doesn't have any budgetary impact.
So there's no consideration for the executive's proposed budget as it relates to these positions. There's no impact. There won't be any impact.
No.
Okay. And how many employees were impacted?
I'll tell you in 1 second. Lots of documents here.
Well, you can let us know.
Yeah, I could send you a follow-up email telling you the number of employees in each classification.
So I wanted to dig a little deeper into the driver's license project.
Sure.
And is Ms. Lockett? Ms. Lockett's not here today. So we were requiring potential employees to have a driver's license, even though we weren't requiring them to have that to do the actual job.
Correct. In certain positions, Madam Chair, yes.
And our solution to that has been to just give us a quick summary again.
Sure. We wanted to ensure that that requirement is actually legitimate, that they actually need to have a driver's license to perform that job. We didn't want people who didn't have driver's license to not apply, to self-select out, although they really could do the job. So we worked with the department management, asked them specific questions, whether the position requires a driver's license, do these people be able to perform the job without one? Do they have to drive in the course of their work? Can they do their work remotely via Zoom, et cetera, certain types of questions. So where we found that a driver's license wasn't required to perform the essential functions, we're proposing that we take that requirement out.
Conwell?
I know this just, through the chair, this just promotes history. I mean, we've had this issue at the county before, so, back in the first administration. So why did we ever have that requirement to begin with? I know you come with a little history, Albert.
Madam Chair, Councilwoman Conwell, there's really not a good answer to that. A lot of these are legacy classifications that have been around since the mid to late 90s. We've never really done a review of these minimum requirements we haven't dug deep into them as we are now, looking into certifications. We want to make sure that people aren't self-selecting out. Our applicant pools are shrinking. We want to make sure that we have as large an applicant pool as possible, so we want to make sure the minimum requirements are truly necessary.
Now, since we're on that subject, in terms of those positions that do require a driver's license, how do we, and they're driving our vehicles, how are they also required to have their own insurance, or are they covered by the county's insurance?
For those positions, Madam Chair, Council, for those positions, they are required to have a valid driver's license and a valid insurance.
That they carry themselves?
That is true, yes.
Councilman Miller?
Madam Chair, to Mr. Bouchardine, could you give some examples of classifications that currently require a driver's license, but under the proposed change no longer would have that requirement?
Madam Chair, Councilman, sure. Some examples of driver's license requirements and classifications that we're proposing be removed are employment testing specialist. That's a position at the PRC. Now, that position is an office position. They're not required to go anywhere, drive anywhere, so it's not really necessary. Another would be compensation analyst. Another would be purchasing agent, staff auditor, workers' compensation coordinator, advocacy officers. These are all positions that are typically office positions that they're not required to drive in the course of their work. So why include that as a minimum requirement in the position?
Madam Chair, on that point, an advocacy officer, I would, in my mind, Albert, I would kind of assume that may include some outreach. Which department specifically would advocacy of offices be, or officers?
Madam Chair, Councilwoman Conwell, advocacy officers in senior and adult services. And I can, when I get back to the office, send you the results or the answers provided by the Department of Senior and Adult Services justifying the removal.
Okay, so as you're scanning the scope of what needs to be removed, you are talking to the department directors.
Madam Chair, Councilwoman, yes, we send out surveys to all the department directors where these classifications, where they had employees in these classifications, and asked them to answer, I believe it's 4 or 5 different questions for each of the classifications. And we use that to evaluate whether it was necessary or not.
So from my understanding, today's legislation before us, is it including the driver's license removal, or that was just a question from the chair?
Madam Chair, Councilwoman, we are recommending the removal of driver's license language from the classifications on the spreadsheet before you. If approved today, we will then go back, do our work, remove them from the classifications.
And there are more after this list?
Not driver's licenses. We're going to be looking in the future to look at, there's a lot of classifications that require certifications, either pre-hire or post-hire, that may or may not be truly legitimate requirements.
Just one other question, Madam Chair. If, and this is, have you been inclusive of Director Lockett?
Yes.
Right.
Madam Chair, Councilwoman Conwell, specifically with the test analyzer software, it's been the PRC staff, Director Kopczynski, Director of HR, Sarah Nemistel, and Director Lockett. We actually had demos from 2 or 3 different companies, and they will all be part of the RFP process.
And that includes the removal of the driver's license from the positions, correct?
With respect to Director Lockett, she, as a director, had some of these classifications in her department, so she was also sent a survey asking whether the driver's license was necessary in those positions, in her positions for her department.
Okay, I just want to make sure it's done equitably. Thank you.
Okay, I had a quick point of clarification as it relates to the deletions and the absorption of other responsibilities. The folks that are assuming these responsibilities, are they being compensated?
Madam Chair, I think you're referring to the position at the medical examiner's office. Those duties were assumed by somebody in a higher, they were lower level administrative task, so they were already in a higher level classification. And then the lower level one position was combined with another position to create a new position. So we're deleting the lower level position that's no longer necessary.
Thank you for that classification. There are no further questions. Is there a motion to move this item to the full body of council for second reading?
I so move.
Second? All in favor?
Aye.
Aye.
Thank you.
Thank you.
Mr. Bushaheen. Okay, Madam Clerk.
Resolution 2023-0289, making an award on requisition 12170 to Sedgwick Claims Management Services in the amount not to exceed $542,500 for workers' compensation third-party administrator services for the period January 1st, 2024 through December 31st, 2026.
Good morning.
Good morning, Madam Chair and committee members. I'm Sarah Nemistel, Director of the Department of Human Resources. This resolution seeks an award to Sedgwick Claims Management Services to perform the county's workers' compensation third-party administrator, or commonly referred to as TPA services. Sedgwick has served as the county's TPA for the past 2 years, and we are requesting a new 3-year agreement with Sedgwick based on the results of a competitive RFP process. Importantly, so HR handles work and compensation for all county employees, approximately 7,700, not just the employees under the executive. As background, when an employer elects to use a TPA, the TPA contracts directly with the employer, whereas the employer's designated managed care organization contracts with the Ohio Bureau of Workers' Compensation. The TPA helps the employer navigate through the administrative and financial functions of the workers' compensation system and plays an integral role in managing our workers' compensation claims and financial planning. Sedgwick has served as the county's TPA since 2022. Prior to that, Sedgwick served as the county's MCO before being replaced by Minutemen Ohio Comp. Both our TPA and MCO firms work closely together with our workers' compensation team to manage the program for all county employees from the filing of a claim until a determination is made. In terms of the RFP process, HR solicited proposals for workers' compensation TPA services through an RFP issued April 7, 2023, which closed on May 8, 2023. The RFP packet was sent to 14 vendors directly, and the county received 4 submissions. A team of 4 members of our HR team reviewed and scored the proposals. Sedgwick Claims Management ranked the highest scoring vendor based on its proposal. This vendor provides a very robust selection of services that include training programs, webinar, claims management, claims representation, and attorney availability for representation at industrial commission hearings. This contract was assigned a 10% SBE goal by the Department of Equity and Inclusion. And the Department of Equity and Inclusion determined that Sedgwick's submission was diversity compliant, along with one of the other 4 vendors who submitted proposals. Sedgwick employs 215 employees in Cuyahoga County and 350 in the greater Cleveland area. The firm is a corporate member of the National Minority Supplier Development Council, was named to Forbes Best Employers for Diversity 2023, and named to Newsweek America's Greatest Workplaces for LGBTQ+ for 2023. After scoring, HR negotiated with Sedgwick on rates, reducing the 3-year cost by $20,600 over the initial proposal. It's a minor increase over the cost of the previous contract, about 2%. We respectfully request that the resolution be moved for consideration by the full council. We are not requesting an expedited process for this contract.
Thank you for that presentation. Have we used this vendor in the past?
Yes, so Sedgwick has been the TPA since the beginning of 2022 and previously served as our MCO with the Bureau of Workers' Compensation.
And what are the services covered under this contract?
So basically, Sedgwick helps us manage the administrative and financial functions of the workers' comp plan. So in terms of managing claims, they will monitor medical treatment in consultation with our managed care organization, which is Minutemen, determine if there's transitional work available, so work within the employee's medical restrictions or rehabilitative services to get the employee back to work in their same job or teach them skills for new employment. They will determine if maybe an independent medical examination is in order and make recommendations on that. They represent the county at industrial commission hearings and provide client education and training. In terms of the financial planning, these services would include auditing our annual experience from the BWC for accuracy and making sure that if any corrections are needed, they file to make the corrections. Evaluating whether the BWC's alternative rating programs may be beneficial for the county from a cost perspective, and if we are eligible for any of the discount programs with the BWC.
And I'm sorry if this is redundant. As you know, I'm still learning. Can you tell me a little bit about what aspects of this contract made it DEI compliant? What does that look like? Sure.
I'm going to phone a friend, Stephen Witt, who is our business manager for HR.
Good morning. State your name from the record.
Morning, Stephen Witt with Human Resources. So following the submission of the RFP proposals, the Department of Equity and Inclusion reviewed the proposals and found that Sedgwick was compliant with the DEI program in that they requested a waiver and conducted a good faith effort to try and find subcontractors, even though they did not end up using any subcontractors in this award.
Okay. Did any of the other bidders comply?
So there was one other bidder that was compliant with the diversity program. Give me 1 second, I can look at the tab sheet. So the other provider is our current MCO, Minutemen HR, and they were compliant under the same results in that they did not end up having a subcontractor, but they were found to have conducted a good faith effort to try and find a partner to work with.
Okay, any questions from my colleagues? Councilman Miller?
Is the trend in our workers' compensation experience currently improving or getting worse in terms of the number and severity of claims that we have?
So I would say over the past 5 or 6 years, we're seeing a better trend. So we had some really rough years beginning in, looks like around 2017, 2018, and 2019. We had high claims, and in 18, we had 310 claims filed, 218, I'm sorry, and 311 in 2019. That went down to 218 in 2020. And for 2022, we had 252. And for 2023, we only have data through the first half of the year. We have 225 so far.
For just the first half of the year?
Yes.
That doesn't sound encouraging,
Well,
because that puts you on track for 450 for the year.
well, we have, we did consult with Sedgwick in terms of, you know, what we needed to budget in terms of reserves for 2024 and 2025. And, you know, they provided us their input, and we're trying. But I think there's been an increase lately, I know, in the Sheriff's Department, but we also have our EHS team, Employee Health and Safety. We hired 2 new people to help our manager, Denny, with that group, and they're going to be looking at ways to work with the departments to try and provide safer work environments and avoid, you know, claims.
Okay, thank you.
One follow-up question. If Minuteman and both Sedgwick were both DEI compliant, what made us choose Sedgwick even though they weren't the lowest bid?
So ultimately, it really came down to the proposals and the terms of the scope of work that Sedgwick, you know, offered to provide. They had a very robust proposal. They talked in depth about the services they provided, what would be available to the county, and also how they are leading in the state for being the TPA for public employers.
Have anybody with you? You came all the way here. You want to come up?
I do. I have Todd Kassarge, who's one of the Assistant Vice President of Programming for
Good morning.
Sedgwick.
Good morning. Thank you for your services. Do you have anything you'd like to share?
Yes.
Excuse me, if you could just state your name for the record, please.
Sorry, Todd Kesserich with Sedgwick. Mr. Miller, I think I provided some information on the claim count for, you know, the years leading up to 2023. And I think the numbers for 2023 for the first half of the year are a little bit inflated. And the reason I say that is because we get tapes from the Bureau on a quarterly basis. And those tapes basically download the information for all of the costs in the claim up through June 30th. Even though we've already come past the third quarter of the year, those tapes have not come from the Bureau yet. However, in my system, what I think is probably happening is even though we don't have cost data on those claims, we have claim counts that probably went through the third quarter of the year. Because to see it jump from a high of 318 to a proposed 450, that's probably the explanation for that.
Okay. I also have a follow-up question, if I might, that the pattern that you described sounds like a COVID relationship pattern. You had high amounts in 2017, 18, and 19, and then it improved in 20 and 21, and then seems to be going up a little bit now. That sounds like COVID. Do you think that COVID was a factor in the claim count numbers?
I would say clearly, especially when you look at the large dip that occurred in 2020. You know, the other thing that I would like to mention is when you take a look at the claim count, that only tells one part of the story. The way that the claims impact any employer in the state, including the county, is more focused on the costs that are associated with those claims. So you could have, you know, more claims in any given year, but if you have the severity jump in any of those claims, then you're going to start seeing a higher impact on increasing premiums. So,
Totally understood. You could have a slew of very minor cases that don't amount to much, and it wouldn't be a problem. And you could have a small number of really big claims and that could do considerable damage, even though the count might look pretty good.
yep, that's correct.
Well, thank you for that value added. Didn't want you to come all the way here and not get an opportunity to say something. So thanks again. Okay. Seeing that there are no further questions, may I have a motion to move this item to the full body of council for second reading?
So moved.
Been moved and second. All in favor?
Aye.
Okay. Is there any miscellaneous business? Okay, I'd like to acknowledge the presence of Chief Katie Gallagher this morning. Thank you for joining us. And since there's no other business, this meeting is adjourned.